When should you actually go to the emergency room? As a registered nurse, I see a lot of confusion about when something is a true emergency and when something could be handled at an urgent care or with your regular doctor. So, I wanted to talk you through a few situations that might help you understand when going to the hospital is the right decision. This is just educational. Again, I'm saying this is just an educational video. If something ever feels very wrong in your body because you know your body the best or with your child, always trust your instincts and seek immediate care. Hey there, my name is Lesline, and I am your favorite nurse yogi. I am a registered nurse with 12 years of experience, and I'm also a certified yoga instructor with 5 years of teaching experience. No, I do not teach in a brick and mortar yoga studio. I teach virtually and with my community doing pop-up yoga classes, conferences, events, those type of things. But today's video is strictly about when should you go to the emergency room, also known as the ER. And I feel like this is an important video to offer because at time of recording, it is March 6, 2026. There's a lot of different changes that are happening within healthcare. And I actually, as a registered nurse, I currently work with the previous job I had was with an insurance company doing authorizations, and where I currently work is with a that was for NICU, and now I work with adults. And I'm seeing, as I'm doing these authorizations to send to billing, some of the people that are coming into the hospital, they could have went to urgent care or they could have just seen their primary care, but we're going to get into why that probably didn't happen. So, why people are confused when they go to the ER. Healthcare can feel very complicated. I feel like that's on purpose. And so the big reason why I show up on my platform is because I want to make you feel more informed. When you are more informed about your health, you make better decisions. And I also want to make this clear, not everyone has access to primary care, and people aren't always sure about emergency room versus urgent care versus primary doctor. And then there's also the confusion can come up about when to go to the ER. There can be fear and anxiety that can make symptoms feel urgent. Also procrastination. Maybe you didn't do your yearly exam for whatever reason. Maybe you lost your job and you no longer have health insurance. And so now you're like, crap, that problem that I was putting off, now it's become urgent. And then you add the fear and the anxiety of your thinking like, oh my gosh, am I going to DIE? And that, that could have been prevented, right? So when we're scared, our nervous system goes into protection mode, and that can make every symptom that you're having feel way more alarming. So most people aren't trying to misuse the emergency room. They're trying to make the safest decision because in that moment, they truly feel like everything's going to be done for them. So let's get into the situations when you should go to the emergency room. And again, I have this lens as a registered nurse, not just from working in the hospital, but now being on the other side, working insurance and seeing the financial aspect as to how I can save you money and how I also have saved the jobs I've worked at. I've saved them millions of dollars, if I'm going to be frank with you, because of the amount of authorizations that I do every single day. So the biggest one, the main reason you should go straight to the emergency room, do not pass go, is if you're struggling to breathe. Like you cannot breathe. Maybe that's because you have a history of asthma and you're currently having a severe asthma attack. Your lips are turning blue. You are having chest tightness with breathing. So that is like the biggest reason as to why you should go to the emergency room, because you are having issues with your oxygen and some type of airway issue. And in nursing school, again, I have not been in nursing school for over a decade, so that might have changed, but I'm pretty sure airway is the main concern, because if you can't breathe, nothing else can happen in your body, okay? Chest pain is always something we take very seriously in healthcare. okay? Especially if you're having pressure or heaviness, like you feel like an elephant is sitting on your chest. Or with the chest pain, you're also having it in your arm or your jaw or your shoulder if you're a woman, because chest pain looks different from a man versus a woman. If you're having chest pain and you're nauseous, you're sweating, you're short of breath, again, circling back to the first reason you should go, shortness, having difficulty breathing. So if you're having difficulty breathing and you're short of breath, you might be having a heart attack, or you could, you might be having a heart attack. But again, this is not a diagnose video. This is educational, okay? Also, you might be having coupled with, maybe it is a heart attack, or you could be having a stroke. So I want to talk about the stroke symptoms. So with stroke, normally, and this is just a general thing, with stroke, it can be that your vision starts to blur, your face starts to droop. Chest pain some can also be a part of that, because if you are losing okay, let me just go through what this is saying. So with stroke, there are symptoms with stroke, and there's an acronym called FAST. So FAST, write this down, put this on your fridge, share this with your loved ones. FAST stands for face drooping, arm weakness, speech difficulty, and that it is time to call 911. With stroke, time is of the essence. Time matters. It really, really matters. The faster that someone gets care, the better the outcome can be. It's not guaranteed, but it can be. Severe dehydration. This one, working on the insurance side, it won't technically, you won't get admitted. You will just stay in the emergency department. This one is completely preventative, y'all, though. If you are staying hydrated, if you are, eating your fruits and vegetables, getting adequate sleep, this one can be completely preventable. Because I'm going to be honest with y'all, when I see dehydration as a nurse, like when I'm doing reviews, I'm like, come on. And then sometimes it's like the person was drinking too much, they had a good weekend, whatever. But severe dehydration, this is what it looks like. Vomiting that won't stop, inability to keep fluids down, extreme weakness, like you can't even sit up before you get up out of the bed. And then if it's a baby is actually dire. So with baby, if they're having very few wet diapers, like especially if they're like newborn stage and you only changed one diaper in a day, take them straight to the emergency room, because you have to remember too, the baby is very small, and so they have less fluid in their body. So any little bit of fluid they lose, like that's a wrap. High fever in very young babies, that is immediately take them to the emergency room, and typically like 100.4 and up, go straight to the emergency room. Do not pass go, especially if the infant is under 3 months of age. If the child's also very lethargic or the difficulty waking the child, you make sure though you keep yourself calm and just bring them straight to the emergency room. So situations that can be urgent care instead, because urgent care is cheaper than emergency room, okay? Typically. Do not quote me on any of these things, but typically. So urgent care can help with things like ear infections, mild fever, sore throat, minor injuries. Like if you broke your leg, and the bone is popping out of your body, go straight to the emergency room. And then like simple infections, okay? Maybe you think like, oh, I think I might have the flu, maybe I have COVID, but you're able to still do your regular like activities of daily living is what we call it in healthcare, meaning like you're still able to like work and take the kids to school, but you're starting to just feel like that weakness and you have a fever. You can go to the urgent care for that. So urgent care clinics are designed to help with these kind of issues, so emergency rooms can stay open and focus on the most critical patients. So ER wait times can be horrible, right? So now I'm going to talk about why ER wait times happen. So there is something called triage. So when you go into the emergency room, and I have been an emergency room patient, I had an allergic reaction 2 years ago now to a diuretic that I was taking to get rid of my acne. if you want to hear more about that, let me know. I did make a video a while ago about my acne journey and how I did clear my cystic acne, but it was a journey and it was a scary one because my lips swole up to the size of Hitch. And as a nurse, I was like, oh my gosh, I'm going into anaphylactic shock, right? But I wasn't really that concerned because my airway was open. Like I was still able to breathe, but my lips were so big. My eyes were fine. Like my eyes didn't shut, nothing like that, but my lips were so big. So with that, when I went straight to the emergency room because I was scared that my throat was going to close, and they triaged me, meaning that I signed in. Like I didn't go straight back like you see in the movies. I had to sign in and whatnot. And then I think I was seen maybe within, how long was I seen? Maybe within 30 minutes. And that, if you're actually going through something, that can seem like a very long time. Let me drink this. So emergency rooms, they don't see people in the order that they arrive. Patients are seen based on how severe their condition is. So if somebody has a stroke or trauma, like the bone is coming out of the body, those people are typically going to go first. And that system is there to protect the sickest of patients. It's important that you trust your instincts. So balance the education that you're learning. Sorry, I have a script, y'all, so I stay a little bit on track. Even with general guidelines, if something feels very wrong in your body or with your child, it is always okay. Like you go to the emergency room. Like if you're just like, if you don't know, but something is very, very wrong, just go straight to the emergency room, right? Your intuition, like you know your body, you know your child. Even if you're like, my child's only 3 years old, like you have been with them since birth to 3 years now. Like you know your child, like just trust yourself, right? So my hope is that this information will help just keep you a little more calmer when you're trying to make these decisions. Healthcare can feel very overwhelming, but understanding your body and knowing when to seek help can make a huge difference. So I'd love to know down below before I close this video, have you ever had a moment where you weren't sure if you should go to the emergency room? I'd love for you to share below because most likely you're okay now. Like if you're like actively going through something, please just go straight to the emergency room. And I'm going to close this video now though. I know we trudged along. Thank you for being here. Make sure you subscribe, like this video, comment if you're feeling a little extra, and share this video with somebody else in your life so we can save you thousands and thousands of dollars, right? I'll see you in the next one. Bye for now.